access. So my name is Melinda Salinas, and I am the Community Relations Specialist and Language Access Coordinator, one of here at DC Health. So our objectives for today are to provide a brief overview of the national standards for culturally and linguistically appropriate services, otherwise known as CLAS. I'm also going to be providing an overview of DC demographics. So we're going to be becoming familiar with the district's limited English proficient and non-English proficient demographics here in the district, as well as going to be going over some high-level legal requirements and the spirit of the Language Access Act and how that translates into your work. And then we're also going to be providing you with a few different resources and tools that you can utilize or that are available for you to be able to carry out the requirements of the Language Access Act. Before I get started, I do want to go over some terminology that we will be using throughout the presentation so that we are starting from a solid foundation of understanding the terms that we're going to be utilized. So the first terms are LEP and NEP. Who is a limited English proficient or non-English proficient individual? So a limited English proficient individual is a person who has a limited ability to speak, read, write, or understand English. For example, this person may be able to respond to simple phrases, such as how are you doing, are you sick, or like specific work-related scenario questions. However, it's important to note that although they have a limited English ability, they may still require language assistance. So a lot of times we see that individuals may have a conversational knowledge of the English language and may be able to respond to those basic questions. However, if you start to engage in a deeper conversation about specific topics, their understanding may not be all the way there. So you want to be mindful of that. And if you or if anyone notices, if you're interacting with this person and you notice that they're struggling to communicate in English or that you're struggling to understand them, you want to make sure that you're also keeping in mind the use of interpretation services or communication tools available. And you shouldn't continue to try and have a conversation with that person unless you're providing the accurate services to be able to secure full understanding. Now, a non-English proficient person is a person who is unable to speak, read, or write, or understand English. Unlike a limited English proficient or LEP person, they do not have any familiarity with the English language and therefore are unable to communicate in English. An important consideration for this particular demographic is that they may also be unable to read or write in their own native language. So sometimes we also encounter individuals that although they are able to perfectly speak their own native language, they may have barriers in writing in their language. You should also consider that when we're interacting with NEPs, they may nod their head in a yes or no motion or another gesture that is simply them acknowledging that they're being spoken to. This is not meant to be understood or interpreted as if they are understanding what you are telling them or you're asking of them. There may be additional cultural factors at play here, and the person may simply be acknowledging again that you're speaking to them, and we shouldn't confuse it as them engaging in the conversation with you. So you should always avoid making assumptions based on a customer's race, color, accent, or appearance. These assumptions are often wrong and sometimes may offend individuals. So when in doubt, always ask for a person's language ability and also be aware of your own biases and ensure that you are taking these things into consideration when we are talking about our limited English proficient or non-English proficient populations. I also want to note that although for the majority part of the conversation, we're going to be talking about foreign-born individuals or U.S.-born individuals, that does not necessarily indicate an LEP NEP status, as many foreign-born residents are proficient in English, and we will get a little bit more into demographic versus being U.S.-born or born outside of the U.S. and language proficiency ahead as well. Our second set of terminology is interpreter and translator. Now, although oftentimes we use these terms simultaneously, I do want to make make sure that we understand the differences between the two, as this is also a critical point of understanding when we're talking about services and ensuring that we are requesting and providing the appropriate and accurate service depending on the need. So what is an interpreter? An interpreter is someone who deals with spoken language. So they take one language and interpret it into another language in real time. Instead of translating word for word, they're seeking to interpret and convey the same meaning. So this person, there's two different kinds of interpretation. We have simultaneous interpretation and consecutive interpretation. So simultaneous interpretation happens at the same time. Oftentimes we see this type of interpretation being utilized for large events, such as conferences, meetings, and things of that nature where we're trying to reach a large demographic group. They oftentimes use assisted devices, like transmitters and headphones, to be able to provide interpretation, especially if we're providing interpretation in various different languages. And then we have consecutive interpretation, which happens one after the other. Oftentimes, that type of interpretation is more suitable or often utilized in one-on-one meetings. Think about if you're providing interpretation over the phone, or if you're just having a one-on-one counseling session. This person will listen to what person A is saying, interpret that into the targeted language to person B, and vice versa. Again, they complete their task orally. A translator, on the other hand, is someone who converts written language from the source language or original language into the target or intended language. They have time to be able to translate a document. They also they have more time to consider different cultural nuances or things, and they're seeking to translate word for word while keeping the meaning and explanation of the document intact. They complete their task in writing. So for example, if I have an English document that is a health notice, a translator is going to take that document and translate it to an additional language, whether that's Spanish, Amharic, or French, and make sure that they are also considering that there may be differences in the language, and making sure that we're accounting for that we're also using a register that is familiar with the targeted demographic that we're seeking to reach. So a quick recap: an interpreter is someone who interprets spoken language from one language to the other, and vice versa, versus a translator who completes their task in writing. They are working with documents and words. So now that we have our terminology and our foundation to continue our conversation today, I'm going to be talking a little bit, providing a brief overview about the CLAS standards. Again, CLAS stands for the National Standards for Culturally and Linguistically Appropriate Services. So what is CLAS? The National CLAS standards are intended to advance health equity, improve quality, and help eliminate healthcare disparities by establishing a blueprint for health and healthcare organizations. Its principal standard is to provide effective, equitable, and understandable and respectful quality care and services that are responsive to diverse cultural health beliefs and practices, preferred languages, health literacy, and other communication needs. It is important to note that although these standards have been primarily created for health and healthcare organizations, they can be adopted and modified for non-health or healthcare organizations. CLAS helps you to consider within your context things like your cultural health beliefs, your preferred language, health literacy and literacy levels, and the various different communication needs that populations may have. Again, always keeping in mind not just the cultural competency lens, but also being respectful, understandable, effective, and equitable in terms of the delivery of services and provision of information. So there are a total of 15 standards divided into 3 major categories, which are governance, leadership, and workforce communication and language access and engagement, and continuous improvement and accountability. So although there are a total of 15 standards, I'm going to go over the 3 major categories. So this first category is governance, leadership, and workforce. Under this category, The standards that fall within this category, they provide the ability to train staff on the class standards, educate and train governance, leadership, and the workforce on culturally and linguistically appropriate policies and practices on an ongoing basis, recruit workforce representative of the community served, and create and support a designated class position within the organization. The second category, which is communication and language assistance, offers language assistance to individuals who have a limited English proficiency and or other communication needs at no cost to them. And they ensure that these are facilitated in a timely manner, and ensuring that equitable access to healthcare and services. Also inform all individuals of the availability of language assistance service clearly and in their preferred language, verbally and in writing, and ensures the competence of individuals providing language assistance, recognizing that the use of untrained individuals and or minors as interpreters should be avoided. It also provides easy access to understand print and multimedia materials and signage in the languages commonly used by the populations that they're seeking to serve. Now, the third category, which is engagement, continuous improvement, and accountability, provides guidance on how to improve collection of race, ethnicity, and language data. They establish culturally and linguistically appropriate goals for policies and management accountability and infuse them throughout the organization's planning and operations. Provides guidance on how to collect and maintain accurate and reliable demographic data to monitor and evaluate the impact of class on health equity and outcomes, and inform service delivery. And lastly, they provide recommendations on how to partner with community organizations to design, implement, and evaluate policies, practices, and services to ensure cultural and linguistic appropriateness. So for the purpose of this training, we will primarily be focusing on communication and language access assistance and the engagement and continuous involvement and accountability components of class, as they lay a good foundation for discussing the importance of the Language Access Act and how that is utilized within government organizations and how that extends to our CBOs, and just kind of how we're taking some of these methodologies, combining it with the DC Language Access Act of 2004 to carry out the important work. So I wanted to also provide you with some examples of what this all looks like here at DC Health as well. So for governance, leadership, and workforce, some of the things that we're doing is providing language access and cultural competency training. This year specifically, we have increased access to our language access training by creating an online version for our staff to be able to take as required by law, but also as refresher courses throughout the year to ensure that they are aware of the requirements, but also that they are provided with tools and resources to incorporate in their day-to-day work to ensuring language access. We also provide guidance on best practices on providing language access services and conducting community outreach to different demographic populations within the district. In terms of communication and language access and language assistance, again, provides culturally and competent linguistically translation and interpretation services. We make sure that we are aware of the district's demographic and the different cultural differences or similarities they may exist, and try to incorporate that into our documents, whether it's campaigns or any other materials. We also work very closely with the Mayor's Office on Community Affairs agencies and our internal bilingual personnel to provide quality assurance on documents and give us feedback on our social media campaigns and or other additional documents for specifically targeted individuals, especially when we have particular campaigns that we're trying to reach particular demographics that are being highly impacted by a particular topic. And finally, under the third major category of engagement and continuous improvement and accountability, We collect and monitor data on language preferences to help inform our language access policy and availability of resources, as well as our recruitment efforts. Again, we also partner with CBOs, faith-based organizations, and other government agencies serving diverse populations to be able to build partnerships and gain a better understanding of the demographics that we're seeking to reach, but also that we are continuously informing our cultural competency lens and ensuring that we are trying to create equitable health strategies. Now it's your turn. So we've provided an overview of our terminology and our class standards, and I would like to hear from you. Maybe what are some ways that your organization is already using some of these standards and or ways in which they can implement the class standards, and especially if you're a non-health serving our organization. So now we're going to jump into the demographic section of this training. Again, to further contextualize the importance of the Language Access Act, I'm going to be sharing some of these demographics. But before I do, can anyone name 4 major languages spoken in the district other than English? And you can feel free to drop it in the chat or unmute yourself as well and call them out. So as you may or may not be aware, the District of Columbia is one of the most linguistically diverse cities in the nation. So there are a variety of different languages spoken here in the district, but the Office of Human Rights has designated the top 6 languages spoken in the district, and as some of you guessed it, those languages include Spanish, Amharic, French, Chinese, Korean, and Vietnamese. However, although those are the top 6 languages spoken in the district, you may also encounter additional languages such as Portuguese, Kru, Tagalog, or other variations of other languages as well. So this is something important to also consider when we're planning any community program, any communications or outreach activities. So to consider who our target audience is and where they're located is super important. And so now we're gonna jump into additional slides that provide useful and helpful demographic information here in the district. So the first chart that I have here is the District of Columbia's foreign-born population demographic profile. So according to the American Community Survey's 5-year estimates from 2016 through 2020, 13.4% of the district's total population checked the box of being foreign-born. The first map here demonstrates the demographic profile of foreign-born residents by regions. So as you can see, we have a larger demographic group from Latin America, which is the yellow, followed by Asia, which is red, and then people that come from different countries and Africa as well, followed by North America, Oceania, and then Europe. The second map here shows the foreign-born population distribution by ward. So we have 8 different wards here in the district, and as you can see, our foreign-born population are not, they're spread throughout all 8 wards. And although historically they have been primarily in wards 1 through 4, through the years, we are starting to see an increase in wards 5 through 8 as well. So it's also important to note that the origin of foreign-born individuals may also vary in each ward, as we'll see in the next slides. Also, just want to put the disclaimer and reminder that being foreign-born does not necessarily indicate that LEP-NEP status, because in fact, some foreign-born residents have high proficient levels of English. So again, this context and this data is merely here to help us see the diversity of our demographic. So I'm going to now break the data up by the different demographic groups, as they're also represented through the Mayor's Office of Community Affairs agencies. So the first group that we have are the foreign-born population that come from various countries in Africa. And as you can see here, as compared to the previous slide, we have higher concentrations of individuals that were born in Africa in wards 1, 2, 4, and 5. But again, in recent years, we're seeing smaller pockets forming in Ward 7 and Ward 8. Now, this chart here now helps us to see a little bit deeper the countries in which individuals are coming from. So we have a higher group of people that are coming from Ethiopia, Cameroon, Ghana, and the Republic of Congo. This data also helps us to anticipate the languages that we may encounter. For example, 30 of this population came from Ethiopia, hence the district's second most encountered non-English language is Amharic. So this information is important to plan appropriately for outreach initiatives and ensure that if we're hosting or attending an event in these areas in the districts, we have translated materials readily available, or that we're able to plan for interpretation services. And then the Mayor's Office on African Affairs is our counterpart that provides technical assistance in French and Amharic. So oftentimes we work with them to either try to reach their community or build partnerships with other faith-based organizations, and or to provide a quality assurance or quality control on translated documents or translation services to ensure that we are utilizing a cultural competency lens. But also, one of the examples that we often see is that we may have someone that requests French interpretation, and it's very French from France is very different from French that is spoken in some of the French-speaking countries in Africa. So again, making sure that we are aware of these different differences and that we are accounting for them in our planning process. The next demographic group that I'm going to focus on is Asia. With our foreign-born population from Asia, they're largely concentrated in wards 1, 2, 3, and 6. And so again, what we're seeing is that there's with housing and everything else in the district, we are seeing populations moving around through all the 8 wards. So again, the second chart here lets us see where are they coming from the region of Asia. So we have a larger population that comes from China, India, and the Philippines. So 17% of individuals that come from China, hence Chinese, which includes Mandarin and Cantonese, is the third most encountered language. And then we have the Mayor's Office on Asian, Islander, and Pacific Affairs that we work with as a counterpart to help provide a technical assistance or to help us in our outreach efforts into the Asian or Pacific Islander community here. So we here at DC Health, one of the other languages that we often see is Tagalog, for example. So those are additional language in addition to the top 6 languages that sometimes we account for, as well as like other languages as well. And the third foreign-born population that I'm going to go over is the population that come from Latin America and the Caribbean. So as I showed at the beginning of the demographic group, this is by far our largest foreign-born population here in the district, which makes Spanish our number 1 most commonly spoken non-English language here in the district. Members from this population are largely concentrated in wards 1 through 6, and historically wards 1 and 4 were the populations with higher concentrations of individuals from Latin America. But again, we have steadily seen a huge uptick in wards 7 and 8 in particular neighborhoods. And so we have definitely over time tried to make additional efforts to also try to meet people where they are or where they're going. So again, the top 10 countries, here we have a large number historically of individuals have came from El Salvador. Here, especially during the 80s, during the Civil War, that a lot of families relocated here to Washington, D.C. So they are one of our longest Latin American populations, followed by Mexico and Guatemala. And then we have other countries such as Colombia, the Dominican Republic, and also individuals that come from Jamaica. And then one of the things that I learned from some trainings earlier with DCPS was that we have there's also now a large Venezuelan population that is equal that of our Guatemalan population. So we're seeing that although we have traditionally had a large number of people that come from Central America, we are starting to see increase of individuals that come from South America. And this is really important to keep track of because there's also huge differences in the regionalisms that are spoken among the different countries. So although they all speak Spanish, there are variations and differences in Spanish that is spoken in most countries in Central America versus countries that speak Spanish in South America. And then, of course, we also know that we have Portuguese, and then, for example, Patois in Jamaica, and all these other different languages. So being aware of this data is very helpful for us to really understand the complexity, but also the vibrant diversity of our population here. Now, in terms of community affairs agencies, we partner a lot and very closely with the Mayor's Office on Latino Affairs to provide whether it's technical assistance or access to the community, as they are very active in the community as well, and to help provide additional guidance when we need to kind of meet certain demographic groups as well. Now I'm going to go into language proficiency among these different populations. So according to the same community survey, we had a total of 701,974 district residents during that period of time, and 13.4% of the population, or 94,193 foreign-born individuals in the district. In terms of language spoken at home, 17.2% of that population that were 5 years and older spoke a language other than English at home. And 5.7% of that population, 5 years or older, speak English less than very well. Another important thing to note is that as we're also seeing an increase of the different populations, we're also seeing individuals who are multilingual individuals. So they have additional language proficiency levels in various languages. This next chart shows the differences between US-born individuals and foreign-born individuals as it relates to language proficiency. Again, the data is collected for individuals who are 5 years and older. So for US-born individuals, 91.7% responded that they only speak English. And then 7.1% of the population speak English very well. And 1.2% of that population would be considered LEP or NEP. When we look at the foreign-born side of individuals or individuals born outside the US, 28.8% speak only English. 38.6% reported speaking English very well. And 32.6% of the population would be considered a limited English proficient individual. So what I also wanted to clarify is the terms less than very well, or LEP and NEP, refers to anybody who reported speaking English not at all, not well, or well on the American Community Survey. So they were considered LEP, NEP. And again, just wanting to emphasize that being US-born does not guarantee English proficiency, just as being foreign-born does not automatically indicate an LEP and NEP status. So before I go into the next section, I want to take a pause and ask if anyone has any questions related to the data or information previously presented. Great. So jumping right into the Language Access Act of 2004, the purpose of the act, in essence, was to ensure that district government agencies named under the act, or government in general, are providing greater access to and participation in public services, programs, and activities among the district's limited English proficient or non-English proficient individuals at a level equal to that of English-speaking residents. So in essence, we wanted to ensure equitable access to both English and non-English speaking individuals to district government resources, services, and programs. One of the things that there's always questions around is who is covered under the law and what is meant by a covered entity. So the law specifies that any district government agency, department, or program that furnishes information or renders services, programs, or activities directly to the public or contracts with other entities, either directly or indirectly, to conduct programs, services, and activities is covered under the law. Currently, there are 39 district government agencies that are covered under the law. And moreover, the law also includes that any contractor, grantee that receives any district government funding through any of those agencies are also therefore by default covered under the law as a covered entity, which means any DC Health grantee or contractor that receives district government funding is also required to uphold the requirements under the law. In terms of the law established that the Office of Human Rights provides oversight of the Language Access Act requirements as it pertains to the district government agencies. So they're charged with the coordination and oversight, as well as providing guidance on best practices. They also consult with the mayor's ethnic constituency of offices, as we mentioned in the demographic profile section, and the DC Language Access Coalition for recommendations or updates to the law or for policies. They all have 4 major responsibilities, which is to provide technical assistance, compliance monitoring, enforcement, and outreach and education. They oftentimes also serve as secret shoppers to the district government agencies and their grantees to ensure that we are providing equitable access across the board. So now let's get to the nitty-gritty. What does the act actually require us to do? So I'm going to be going over the 5 major requirements under the law. And the first one is the provision of interpretation services. So district government agencies or covered entities are required to provide interpretation services through qualified bilingual staff or qualified interpretation services to customers seeking to access or participate, access to information or participate in the services or programs offered by the covered entity. The second major requirement is that we are required to translate vital documents. The law provides that we are to translate vital documents into any languages that reaches a 3% threshold or 500 individuals of the total population served or encountered by the covered agency or likely to be served or encountered by the agency. Here at DC Health, we primarily translate most vital documents into the top 6 languages in the district. However, because we have started to see an increase of Arabic speakers, we're also doing targeted outreach to the Ukrainian and Russian populations. We have begun to translate our documents into those additional languages as well, just as a best practice. One question I also get asked a lot is what constitutes a vital document? So a vital document, in essence, is any document that provides information to residents regarding how to access programs or services, any kind of health-related or emergency-related documents pertaining to public health. We also have forms that people need to fill out in order to be able to obtain benefits or access or file complaints. Those are all examples of vital documents as well. The third major requirement is also the provision of training. So we are required to train not just our staff, but also our grantees and contractors on the requirements of language access and all the different things that are required by the act and how it relates to their work. And again, this is what also helps us to kind of promote some of those standards that we talked about in terms of the national class standards. The fourth major requirement includes outreach. So we are required to conduct outreach to the limited English proficient and non-English proficient populations about their rights and their services, including bilingual outreach materials and advertising the availability of language access services through targeted media outlets and community-based partners, among other things. And this is where the work that all of your organizations also come in hand as a grantee of DC Health, but also in the work that you're doing in the community, is making sure that we are establishing and partnering with our CBOs to fulfill this requirement, but also to making sure that the vital information or programs and services are being informed to the public, especially our LEP and EP populations, in addition to any other special populations that we're seeking to reach. And the final major requirement that we have is a collection of data. So under this requirement, we are responsible for collecting, reporting, and analyzing data on the demand for services in languages other than English, updating our existing databases and applications and tracking systems to ensure that we are able to capture the public demand for language needs. So these are all things that we consider and we try to build capacity around to ensure that we're collecting this data and that we're able to report back to our partners as well in terms of who we're seeing and where the needs are to be able to properly allocate funding and resources. Another requirement of the law that falls under interpretation is the posting of signage. Now, this is an example of the language identification poster that we are required to display, which assists individuals in identifying the preferred language of customers if you are in person. It's easily accessible to download and to print and to have available, and it is required to be in a visible location so that people are able to view and utilize it if they're having any trouble with understanding information and require language assistance. The other requirement when it comes to interpretation is the use of waiver forms. So under this requirement, if an LEP and EP customer, let me backtrack. Our first and foremost requirement in due diligence is to ensure that the public understands that they have the right to request and access free interpretation and translation services. Once we have offered that and made that clearly aware, then a customer may choose to utilize those services, or you may be in a situation in where they refuse those services. So if a customer refuses the use of interpretation or translation services that you are offering, whether it's through Language Line, whether it's through your bilingual personnel, we do have to use a waiver to ensure that we are documented that the free services were offered, however the person's refusing to use the form. The form should be available in all languages. So the Office of Human Rights has translated these documents into the top 6 languages spoken in the district. And what you'll see is that the targeted language is up top and the English language is at the bottom, so that both you are aware of what you're asking someone to sign, but that, you know, it's also documented that the person has been made aware of their rights and that they're voluntarily waiving their rights. If you are speaking with someone over the phone, you can also read the waiver over the phone and get their consent that way. We understand that sometimes individuals might bring a counterpart to say that they would feel more comfortable with having them interpret on their behalf, but because we are required to use the use of qualified interpretation services, we want to make sure that we're not leaving any room for misunderstanding, especially if part of that understanding could mean the difference between somebody getting access to any benefits, programs, or services. And now I have a question for you. Provide interpretation services in a district? You can either unmute yourself or enter your response in the chat. And again, the question is, can minors provide interpretation services? The answer is no. minors or anyone under the age of 18 should never be asked or allowed to provide interpretation, whether it's a clinical setting, a school setting, or a community setting. And can anyone take a guess as to why? One of the main reasons why we don't allow minors to provide interpretation services, because depending on their age as well, they may not have acquired the knowledge skills of a particular topic, especially if you're like in a clinical setting, or you're discussing topics in a community setting, say, for example, domestic violence or substance abuse. And then in addition to that, you're positioning the minor in a position to have to navigate and struggle through power relationships, especially if it's for their parents or other family members as well. So if you ever encounter a situation in where you're trying to assist somebody and providing them with interpretation services, and the person refuses and they want to use a family member, I would always strongly suggest that, number one, aside from signing the waiver, that you do ask and verify if the person is over the age of 18 and if they feel comfortable with providing interpretation for the particular setting. Another thing to consider here is that although you may have individuals, or whether it's staff members or family members who are considered bilingual or who consider themselves to be bilingual or native speakers, that does not necessarily mean that they have the proper skills to serve as an interpreter. And I always use the example that, say, for example, I was born and raised here in the district, but my first language was Spanish. And I do consider myself a bilingual individual in English and in Spanish. If you were to ask me to serve as an interpreter, either in a medical setting or in a legal setting, I will tell you 100% I do not feel comfortable, primarily because I do not have a legal or medical vocabulary that I utilize on a day-to-day basis to be able to feel competent enough to interpret for somebody who's either receiving a medical diagnosis and or who is going through a legal proceeding. So again, this is why we stress the use of qualified or certified interpreter and or translators, as these are individuals who have acquired a certain particular skill and or certification that they are able to do so. So the other thing that the law allows for is the filing of language access complaints. So the Language Access Act provides that you can file either formal or informal complaints by customers who are limited English proficient or non-English proficient. Complaints can be filed in person, over the phone, via email, or online using a multilingual form. In the past, the only option was to fill out the form. However, the advocate organizations for language access and community-based organizations flagged for the district and the Office of Human Rights that, filling out this electronic form was a barrier to a lot of our LEP residents. And so the act was amended to provide additional opportunities to fill out this form. That also includes, as part of the Education Amendment Act of 2018, that also allowed for, I believe, for CBO organizations to file language access complaints on behalf of individuals. And once that law is also fully funded, if a covered entity is found to be in violation of the act, they can issue a $2,500 fine on an agency for noncompliance. OHR conducts a pre-investigation resolution process before assigning language access complaints for full investigation. Oftentimes what this means is if a complaint is filed with the Office of Human Rights, they engage the covered entity to try and find what actually happened and be able to look at that and also provide a resolution before moving forward. and the complaints form is available in the top 6 different languages. But again, the Office of Human Rights would be responsible if there's a individual who is seeking to file for a language access complaint. They will translate that form if there's another language that is being requested. This is why, again, to reiterate, as a grantee of DC Health, it is important that you are aware of these requirements, but also that if you are, whether you are proactively doing outreach to LAPDP community or LAPDP member is made aware of your services through DC government, that you have access to the waivers, and ensure that if the person is refusing those services, that you have them sign the waiver. It protects you as the organization, as an individual, and DC Health as an agency, but furthermore, it also prompts you to go through the process of making sure that we are offering the services as indicated. So we're going to talk a little bit. Prior to today, were you aware of the DC Language Access Act of 2004? And if so, where did you hear about it? So my next question to you is, how does your organization provide language access to LAPDP members? And if you do not currently serve LAPDP members, if you want to speak about maybe some ways or things that you can do to ensure that you're providing language access to LAPDP members if you would encounter them. So my third question is, what are some challenges, if any, that your organizations have or having, or that you potentially see having, in terms of providing language access to your particular community members? So that brings me into the next section for outreach. So earlier we started off with talking about the demographic here in the district and the diversity that we have, where they're located throughout the wards. We talked about the language access requirements, and I wanted to tie into some other requirements that we have in terms of outreach, but also some best practices that we have seen. The first one being the use of taglines for documents. So the Office of Human Rights has provided some guidance on best practices on to use taglines in our documents. So as I've mentioned before, we do have a requirement to translate certain vital documents into languages, provided that they meet certain thresholds, but sometimes there's other documents that may not be constituted as a vital document. But a best practice is to always provide a way for individuals to be able to obtain that document in a different language. And say, even if you've created a vital document, but your primary focus is English-speaking community members, you still want to be able to provide, even if you're not translating that document, a way that people know that the information contained within that document is vital, and a means from them to obtain that information. So the first version of the tagline, which is a very shortened one, because we know that sometimes when we're dealing with flyers and things like that, there's limited spacing, is simply says, if you need help in your language, please call blank for free interpreter assistance. Very simple, to place. The second is a longer version, which states, this document contains important information, so you're letting the person know this is a vital document. If you need help or have any questions about this notice, please call, provide a number. Tell the customer service representative the language you speak so you can be provided with an interpreter at no cost to you. So again, key things, whether it's a phone number or an email address, is informing them that they have the right to request this information and that they have the right to request this information at no cost to them. You're providing them either with a number, an email box, or a different way to get in contact with somebody. The next best practice that we have when it pertains to taglines, again, so the examples that you see here are just two different say announcements for an activity that has all the information from date, time, and what's going on, right? But then you have the use of the taglines in different ways. So for the English version, you want to make sure that you're including that tagline in at least the top 6 languages that are spoken in the district, as you see on the left-hand side. For language-specific flyers, you can simply include the targeted language tagline. If additional information or services are going to be offered during an event. So say, for example, jumped ahead. As you see on the right side is an example of a Spanish language flyer that again provides all the date and time information about the event, and then the tagline is only provided in Spanish, and that is mainly to ensure that the person wants to participate in the activity, they know that they can request an interpreter at no cost to them by calling a certain number and letting us know that they require interpretation, versus the English language one, which provides that tagline in all the different languages. The second example of providing is providing equitable access during a registration process. We are seeing that for a lot of events now, there's a pre-registration process that occurs, whether it's through Eventbrite or any other kind of registration link. We want to make sure that you're providing access, especially if you're requiring people to register in advance for the event during that application process as well. Couple of key things to always consider is providing our LAPDP customers with 1 or 2 ways to contact the agency or your organization should they require language access services. My counterpart, Ivan, he is always a proponent of providing at least 2 ways, whether it's a phone number and an email address, because we know that sometimes there's a barrier to accessing email boxes. So if you have a phone number, that's always the top preference. The second thing to consider is inform customers how many days in advance notice they need to provide to accommodate their requests. This also serves true, for example, if you have someone who is in need of interpretation services in American Sign Language, we want to make sure that you are given proper notice to be able to plan for those things in advance. And then the third thing to consider is, if applicable, notify customers where the event is to be held, i.e. Whether the event is going to happen in person, whether it's a virtual event, and through what virtual platform. We do find that a lot of the times when we are scheduling for events or interpretations, this information is left out. Or say, for example, you may have a registration process that asks the question of, hey, do you require interpretation services? But then everyone else gets the English notice to say, hey, this event is happening via Zoom on X day, here's the link. But then because that person may be an LAP or an EP individual, if they receive that information in English, they do not get the information as to where and when that activity is to take place because they do not understand. So wanting to make sure that you account for those things as you're thinking about creating your collateral for outreach events or activities and things of that nature. Just, again, keep these things in lines and always consider the use of proper taglines. And notice that if you are advertising that language access services can be provided at the event, then the registration process or application should also be made available in those applicable languages. I won't dive too deep into this, but if you ever have any questions, feel free to reach out to me. Different platforms, depending on what you're using, may sometimes already have some kind of functionality in there to translate the form. For example, Microsoft Forms typically has an option where you can make that form available in different languages and the person can self-select their language. Eventbrite is a little bit more difficult, but there are ways and best practices in which we here at DC Health are trying to create a policy around that. For example, in the body of the invitation, keeping your invitation short and concise, using plain language with the information that's needed for the event, allows room to be able to then translate that information and post it and have it readily available in the different languages. So if you need any help or assistance around that work, I'm more than happy to work with you and provide some additional guidance on that. The other thing is that, again, with the signage and poster requirements, you want to make sure that if you are conducting outreach events, specifically in LAPDP communities, that you have the language interpretation poster available, and that you plan ahead to have information that's translated into different languages. So this is why, going back to that demographic data, that is super important when you're going to be doing outreach, even if your particular outreach event, or if you're tabling at an event, is not necessarily tailored towards LEP community. If you are going to an area, for example, if I'm doing an outreach event in wards 1 or 4, I always make sure I have information in Spanish and at least Amharic, if any other language. And if I'm going to, I think it was at Ward 3, I make sure that I have Korean, Chinese, and Vietnamese information available as well, because I know that I am likely to encounter someone who may or may not be an LEP or NEP individual, and I want to make sure that I have information readily available, or a means to get that information to them. If you are utilizing any DC Health collateral and you want to have that information available in different languages, feel free to email Monica or myself or Leah and Kimmy requesting that information. A lot of times we have the information translated. If not, if it's something that DC Health created, we are more than happy to translate that for you to help you and assist you in your efforts. The other thing that I will say in terms of a resource is that if you do not already have an account with LanguageLine, that is something that I would highly encourage you to do so. You don't get charged for creating an account. You do get charged for the services that you use, but they also have a pretty cool LanguageLine mobile application that can be downloaded on your phone that automatically gives you access in real time through interpreters. And that also includes video ASL interpretation as well. So again, something to consider with reaching not just LEP and NEP populations, but also our either deaf or hard of hearing population as well. So now there's room for another discussion. So the first question here, again, is how is your organization reaching out to LEP? Oh, sorry, someone duplicated the questions. We did talk about this, but I guess if anybody had anything else to add with regards to the outreach portion of the information. But again, the two questions are, how is your organization reaching out to LEP populations currently, or if you plan to do so in the future, and if there are any challenges or successes in reaching out to the LEP populations that you want to talk about? Great. So we are reaching the end of the presentation. So I did want to leave with some additional resources. So the Office of Human Rights has a language access portal for covered entities, and you can find a ton of information here, anything from vendor details and contact information for the vetted citywide translation and interpretation vendors, including LanguageLine. If you're interested in setting up an account with them, you can find their information there and reach out. There's also a list of other vendors that have been vetted and approved through the district as providing quality and competent translation interpretation services there. You can also download the different forms and signs that I mentioned, including the waiver and the language ID poster. They also have additional guidance on best practices for different situations or scenarios on data collecting, reporting, and or conducting outreach, as well as if you're interested in reading on the actual law or policy or any regulation text is available there. I do want to add that if you need access to a DC Health resource or document, please contact our DC Health language access team first, as we will be able to let you know if that document is available or not, or if you have you're having a challenge navigating certain aspects and you want some guidance on that too. We're more than happy to work with you and help you and share any resources if available. The second set of resources that you have are the Mayor's Office on Community Affairs agencies. So as I mentioned throughout the presentation, we have the Mayor's Office on Latino Affairs, as well as the Mayor's Office on Asian and Pacific Islander Affairs, and the Mayor's Office on African Affairs, as well as a DC Language Access Coalition, and their numbers and websites are all listed here. I will add that in addition to these three MOCA agencies, the Mayor's Office of Community Affairs agencies, also has additional community specific organizations, such as they have now a Mayor's Office in Caribbean Affairs, a Mayor's Office on Deaf, Blind, and Hard of Hearing. They have a faith-based office, veterans-based, women's policy initiatives office. They have various cultural or community affairs offices there. So I would definitely, if you have not already engaged with them, definitely reach out, especially as you're thinking about and planning different outreach activities for this next fiscal year. They're great resources. Often, a lot of the times, they can also open doors to have access to other communities as well. Since we briefly touched base on the national class standards, if you are interested in learning more about the specific standards, as I mentioned, there's 15 of them, and they do provide a pretty good framework and blueprint for just providing culturally and linguistically appropriate services, although the framework is intended for health and healthcare organizations. Again, a lot of the stuff that they have can be adopted and replicated in non-health and healthcare serving institutions. So I would definitely recommend that website is thinkculturalhealth.hhs.gov, and they have a ton of information, a ton of training slides there to also help with building capacity within your organizations. And that is all for me. I'm going to stop here, and if there's any questions, please feel free to unmute and ask them. And if not,